This is a video introduction of the Creative Health Review, how policy can embrace creative health.
Hi, I'm Hannah and I'm the Research and Policy Manager at the National Centre for Creative Health. I'd like to introduce the Creative Health Review, which is a piece of work that we've been doing with the All-Party Parliamentary Group over the past year. So the review was published in December 2023, and it's available now on the National Centre for Creative Health website. The review builds on a recommendation in the 2017 APPG Inquiry Report, Creative Health, for a cross-governmental strategy to support the delivery of health and wellbeing through arts and culture. And in the review, we highlight the ways in which creative health can help to tackle pressing policy challenges, particularly in health and social care, by bringing together evidence and examples of good practice. And we also look at what's needed for creative health to be implemented more widely within systems. The review sets out key messages for policymakers and makes recommendations to national government and metro mayors for a cross-departmental creative health strategy. So here I'll introduce those key messages and recommendations and explain why we think a cross-departmental strategy is important, as well as the benefits this approach can have for individuals, communities, and systems. But first, I'd like to talk a bit about what we did. So we launched the review in October 2022. We held a series of online roundtables on key themes, inviting a mix of policymakers, academics, practitioners, and people with lived experience to discuss current challenges and the role for creative health in tackling them. And these sessions are available on the NCCH website, along with some additional resources if you'd like to watch back. We had a brilliant panel of commissioners who were experts and leaders from health and social care, arts and culture, and policy making. And they supported us to assess the evidence and develop our recommendations. You might recognise some of the faces here, and you can find some more details about our commissioners on the website. We were also supported by a fantastic lived experience panel, and this was made up of those who'd shared perspectives from their own experiences in our roundtable sessions. They also shaped our thinking about the review process, as well as the recommendations. And you can see on this slide some of the powerful testimonies that our panel members provided about the power of creativity and the impact on their own health and well-being. We invited creative responses to the review themes from artists with lived experience. You can see some of them here, and the full range, which also included creative writing, spoken word, and photography, is available on the NCCH website. And throughout the review, we ran an open call for submissions through which people could tell us about their own creative health experiences or practices and share examples and evidence. So in the review, we looked at themes where we know there's a challenge to meet, but also where we know creative health can make a real difference. This included mental health and wellbeing, with a particular focus on children and young people. We covered health inequalities and the role for creative health in addressing inequalities in both health outcomes and access to healthcare, as well as in improving the places that people live in through community-based activities and creative and cultural placemaking. We looked at how creative health can be used to support people accessing social care, as well as the social care workforce, and we discussed the vital role that creative activity can have at end of life. We then went on to look at implementation of creative health and what it is we need to do to create the conditions for creative health to be integral to health, social care, and wider systems. Under the theme of education and training, we considered the importance of creativity in the school curriculum, as well as training and development of a representative and sustainable creative health workforce. We collated evidence around cost effectiveness and value for money of creative health, as well as the ways in which systems can support creative health to thrive through collaborative and distributed leadership and the establishment of equitable and sustainable funding and commissioning models. And through the process, we identified some key overarching messages for policymakers. Firstly, that creative health is fundamental to a healthy and prosperous society, and its benefits should be available and accessible to everybody. Secondly, creative health should form an integral part of a 21st century health and social care system, and we believe that's one that's holistic, person-centred, and that focuses on reducing inequalities and supporting people to live well for longer. And finally, that creating the conditions for creative health to flourish requires a joined-up whole system approach, And this will incorporate health systems, local authorities, schools, as well as the cultural and BCSE sectors. An ever-strengthening evidence base tells us that engagement in arts and culture can improve mental and physical health, and it does so through many different mechanisms. In the review, we bring together the evidence for creative health in prevention, treatment, management, and recovery of specific health conditions, and its use as an effective tool in supporting people with their mental health. We describe the benefits that creative health can have for individual health and well-being across the life course, and its role in supporting quality of life for people with longer-term conditions as part of a person-centered approach. Creative health, implemented as part of an upstream preventative approach to health, not only keeps individuals healthier for longer, but can contribute to a reduction in health inequalities and the generation of a healthy and prosperous society over the longer term. And here you can see a quote from one of our commissioners, Professor Sir Michael Marmot, who helped us think through how creative health can help to tackle inequalities. And you can find examples in the review of creative approaches being used to address clinical priority areas for health inequalities. We discuss how creative health can be used in the co-creation of more accessible and appropriate services. And we look at the link between deprivation and health, where we think more broadly about the role for creative health at place and in addressing the social determinants of health. In social care, creative health can empower people to engage in activities that are meaningful to them, enriching quality of care and leading to improved health, well-being and quality of life. And the review provides examples of this in practice in a range of social care settings, for example, with older people and people living with dementia. And for children and young people in the social care sector, creative health improves mental health and well-being, facilitates self-expression, fosters a sense of belonging, and has a positive impact on future outcomes. So creative health has benefits for individuals, communities, and systems. And the report shows how embedding creative health can improve the quality of health and care services and reduce pressures on overburdened systems by supporting people to live healthier lives for longer. The theme of leadership and strategy in the review considered evidence from systems that have taken a lead on integrating creative health. And this finds that integrated care systems offer an opportunity to move towards more strategic partnerships between healthcare systems and creative health providers. It finds that building sustainable commissioning models for creative health has benefits for patients, providers, and systems, and that creative health supports systems to improve health outcomes and meet their responsibility to address health inequalities. This is a quote from another of our commissioners, Rob Webster, who's CEO of West Yorkshire Integrated Care Board, who believes, as we do, that national creative health strategy will maximise the impact that creative health can have and facilitate delivery across all levels of the system. So given the evidence that we provide in the review that creative activity improves our health and well-being, we think of creativity as a determinant of health. The benefits and opportunities are cross-sectoral, incorporating but not limited to health, social care, culture, education, criminal justice, and skills and employment. We're very clear that a coordinated cross-departmental strategy is required to ensure these benefits are available to all. In our key messages, we emphasise creative health as part of a 21st century approach to health and well-being. And such a large proportion of health outcomes are a result of the social determinants of health. So the causes of ill health related to the environments and conditions that people spend their lives in. A preventative and health creating approach, which supports people to live well and reduce health inequalities, is vital to reduce pressures on our system over the long term. And responsibility for that lies across all government departments. So we believe that a dedicated creative health strategy can move us beyond silos and convene governmental stakeholders to develop a shared language and outcomes framework that will amplify the benefits of creative health. We therefore make the following recommendations to government. Firstly, we recommend the development of a cross-departmental strategy, and this should be driven by the Prime Minister and coordinated by the Cabinet Office to ensure the integration of creative health across all relevant policies. Secondly, the long-term value of investing in creative health should be recognised by HM Treasury and appropriate resource should be allocated. And thirdly, lived experience experts should be integral to the development of the strategy. The review then also identifies opportunities within individual departments through which creative health can support departmental priorities, and also actions which fall within departmental remits, which can support a creative health agenda. And we make specific recommendations to metro mayors and combined authorities who can incorporate creative health into their regional approaches to improving health and wellbeing and economic prosperity for their populations. So what's next? The review's made recommendations to government, and so we'll continue to make the case for a national creative health strategy. But it also highlights the really innovative and exciting work that's already taking place at grassroots level and how this can be supported by and integrated into systems. We hope the review will be useful to those in health and wider systems to understand the benefits that creative health can bring, and that this will help us to create the conditions for creative health to flourish. You can find out more about the review on our website and access some additional resources, or do feel free to get in touch with any questions. Thank you.